What is SCA12?
When we talk about SCA12, it is spinocerebellar ataxia type 12. As the name implies, somewhere the most important thing is involvement of small part of brain known as cerebellum, back of brain, cerebellum. And the patient comes to us with tremor, shaking of the hand, walking imbalance, speech problem, slowly progressive. It starts late in the life, maybe fifth or sixth decade, in some cases fourth decade, and slowly progresses. So that's SCA12 for you. SCA12 is very rare condition, and it affects a particular group of people who belong to business family, Agarwal family. So almost it's confined in that group. And this is autosomal dominant condition. What it means that it is genetic condition, comes from subsequent generation, and the gene that's affected that is confined in that family. And as happens in India, especially in the Agarwal group, generally intercaste marriage is rarity. It's rare. So till date, it has confined mainly to this family, and we see very few patients outside this population.
What are the other conditions SCA12 is confused with?
Let's start with how the patient present, and that will give the idea that how the patient can be confused for family as well as doctors. The reason I'm telling you that I have patients clearly SCA12, but they have been diagnosed as Parkinson's disease or some other condition for years altogether. In fact, the patient says that my father used to have Parkinson's disease, but it was very clear that it was SCA12. So how it can be confused? Patient generally present with tremor. Tremor means shaking of the hand or shaking of the head, or sometimes voice shaking also. When you have tremor at say fourth or fifth decade, the first diagnosis comes into mind is the patient anxious? Is the patient little troubled? Does the patient has a condition of essential tremor? So essential tremor is a condition that starts at that age, that present with tremor. So I would say majority of patients initially they are confused with essential tremor, because in essential tremor, that's another common condition. Essential tremor is seen in about 10% of normal population after say 60 years of age. So you can imagine that such common condition is essential tremor, and SCA12 is a minority, a small condition. And it's very common that SCA12 patient is misdiagnosed as essential tremor. So that's one diagnosis. Second is Parkinson's disease. As you know that in India or anywhere in the world, that tremor, people feel that is Parkinson's disease. So right, so if the patient has tremor, and as you know that in SCA12, patient has walking difficulty also, which is seen in Parkinson's disease. So Parkinson's disease is a second condition which can be confused. So to answer your question, I would say that anxiety, essential tremor, and Parkinson's disease, these are three major groups where SCA12 can be confused. And I would say that as a movement disorder specialist, across the India, we have seen that almost all the patients, they are diagnosed essential tremor or Parkinson's disease first, and then they are diagnosed as SCA12 after doing some test or after being little more cognizant about it. A good thing about SCA12 is that this is not rapidly progressive. This progress is very slow, right? So people treat for essential tremor, people treat for Parkinson's disease, patient they don't respond, then they change to neurologists who know about it, or they develop some symptoms which are not seen in Parkinson's disease. So we talked about tremor. When the patient starts gait imbalance, imbalance means ataxia. Parkinson's also has imbalance, but ataxia is different. In ataxia, people walk like a drunkard. They sway on both sides. In Parkinson's disease, they walk slowly, they are stooped forward. And when we see the symptoms, which are not evolving like Parkinson's disease, or in essential tremor, you'll have only tremor, no other symptom. But in SCA12, other symptoms they start adding up. Then people feel that this is something else, and SCA12 is suspected. More importantly, we have to see family history. If family history clearly positive of similar illness, and second, if the patient belong to Agarwal family or this people originating from Agroha, which is part of Haryana right now, so then you have to suspect that this is SCA12. If you want to know the difference between Parkinson and SCA12, how a neurologist or movement disorder expert they differentiate, I would say quick two tips here, which can help doctors as well as patients also. In Parkinson's, tremor is mainly rest tremor. While they are sitting, they have tremor. They are sitting, they have tremor. In SCA12, they have action tremor. When they hold something, then tremor is more likely. In Parkinson's, they have slowness. They walk very slow. In SCA12, slowness is very late feature. It doesn't come that prominently. In SCA12, slowness is not a feature. Balance or fall is prominent. So these are the features we differentiate from Parkinson's and SCA12. Regarding essential tremor can exactly look like SCA12. But again, there are subtle differences there which we published also. Tremor of essential tremor, they're a little fast. The hand go a little fast. In SCA12, this is a little slow tremor. Action tremor, but slow tremor. In SCA12, tremor can affect a proximal area, that means shoulder and elbow more than the finger. So there's subtle difference, but yes, essential tremor is very difficult to differentiate from SCA12. In SCA12, in due course of time, they have other features like ataxia, which can become very prominent. In essential tremor, ataxia means walking imbalance. When they walk with wide base. They sway on both sides. That's generally not seen in essential tremor.
Why should SCA12 patients and caregivers watch progressive symptoms carefully?
First of all, tremor should not be swept under carpet. If the patient is shaking or tremor, that may be indicator of many conditions. That includes SCA12, that includes essential tremor, that includes Parkinson's disease. So you should not be blamed that you're old, you're getting old, that's why you're shaking. You're anxious, that's why you're shaking. They should see a doctor or they should see a neurologist who are expert in this. When the tremor appears, we also have to see that is it only tremor or is it voice tremor also? Is it only hand tremor or is it voice tremor? Does the patient have some walking difficulty? And walking difficulty, when it comes, it's clear indication that something else is going on apart from what we see in essential tremor. So two things caregivers have to see, that how is the walking, number one. Number two, whether tremor is worsening with time. And number three, in SCA12, as the disease evolves, the patient also have non-motor symptoms like memory problem, executive dysfunction, means not planning properly that how to do this job properly. And apart from that, some recent memory problem that has been seen in SCA12 also. So the caregiver should keep an eye on all these 3-4 symptoms, and that will help caregivers to report to the doctors what is happening. As happens with any nerve degeneration, treatment is limited, except for Parkinson's disease. So there is some treatment for essential tremor, SCA12, but I would say that it keeps on progressing very slowly. So first of all, the patient should prepare themselves that this tremor what I have today may worsen with time, slowly, but they may worsen with time. I might have some balance difficulty in due course of time. That may take years altogether, sometimes decades. That can worsen with time. And most importantly, fall can come up. So we suggest to plan life. I suggest to plan life accordingly. That say after 10, 15 years time, when the symptoms start, they don't have to do fine motor job. Fine motor job will be difficult. So delegate signature or fine motor job to other people of the business or job. So that's one. Second, that we suggest to exercise rigorously, because exercise helps in improving the muscle strength. Exercise helps in coordination also. So as the balance worsens, exercise will help them to prevent falls. If the muscles are strong and if the balance is by exercise, they have improved the balance to some extent, fall will be less. Finally, when the disease comes to the extent that fall is imminent or balance is really poor, then we suggest patient and family members that one thing that can suddenly worsen the symptoms are fall. So you have to keep an eye. Somebody should be around. There's no harm. There is no ego problem using the stick or walker. So these things we have to keep in mind. And at the same time, I would say that this is such a slowly progressive condition. Suppose a patient is 50, they start having SCA12-like symptoms. It takes 15-20 years time to really to cripple them or to be really significant. So by 70, they have lived good life, right? They have they have contributed to society, to business. So when it starts, I won't say that it's a bad disease. It's a disease which have to tackle. We have to continue working in the way you are, but just plan for the future in a way that is more practical when the time comes.
What should physicians watch out for to diagnose SCA12?
Yeah, when we suspect SCA12, so first of all, if the patient comes to me with tremor, tremor is the most common symptom. Hand tremor is in 90% of cases. And then they say that I have little wobbliness, little difficulty in walking, right? Then the red flag is raised. But when the patient has tremor only, and when we see that patient has clear family history, that father had or mother had, grandfather had, any brother has, then we suspect that something familial is going on. And that familial can be SCA12 or even essential tremor, familial essential tremor. But apart from tremor, any other symptom is there, as we talked, that walking imbalance, then SCA12 is more likely. But more than that, if we see a title, if we see the surname Agarwal or in any surname which indicates towards Marwadi Agarwal family, then we suspect SCA12 high on the list. And in that case, we go for two tests. One is MRI brain, just to see that are we missing anything else? Because ataxia, tremor, walking difficulty, and tremor can happen with other conditions of the brain also, like small stroke or some myelin sheath problem, like multiple sclerosis. But if MRI is not showing anything or showing just dryness of cerebellum, mild atrophy of cerebellum, then yes, we might be dealing with SCA12. In that case, a simple blood test for SCA12 is done. The gene test is done to see the particular thing what we call as repeat, CAG repeat. CAG is the code, a genetic code for nucleotide. If we see that repeat more than 43, 44, that means most likely SCA12. So to answer your question, SCA12 is diagnosed on the basis of symptoms, just seeing the MRI to rule out other conditions, and simple blood test, genetic test, which is not very expensive nowadays. It costs about 4,000 rupees or so, and that confirms the diagnosis. If gene test is positive, it is SCA12. So there's no ambiguity then. If gene is positive, it is SCA12. There may be some other conditions also along with that, but it is SCA12. So gene test or blood test, a simple blood test that helps in nailing the diagnosis.
What treatment options are available for SCA12?
As happens with a lot of orphan disease like Huntington disease, like dementia, rare dementias, SCA12 is a nerve degeneration where we don't have cure per se. That it's not that we can cure, but of course there are medications, there are ways to improve the symptoms. As the patient has tremor means there are medications for the tremor that across the board it improves tremor to some extent, like beta blocker, we call it propranolol, primidone. Primidone is another medicine for tremor. I find, and a lot of people have found that they are effective in reducing the tremor to some extent. They don't cure, they don't suppress completely, but they reduce and they improve quality of life. So that's one. If we talk about walking difficulty, balance problem, there is no proven therapy for that. But some medicines, they work in balance in other conditions. And as part of repurposing, we try that. And in some patients, we find useful. For example, there's a medicine known as amantadine that helps in balance in Parkinson's disease. And we use in this condition also. And in some patients, they find partial improvement. Very interestingly, we have found that SCA12 patient has dopamine deficiency also. We have a study and we have seen patients in SCA12 patient, when we send for dopamine scan known as TRODAT scan, we found that dopamine is also less. That means Parkinson medication like levodopa can be used, and I have used that with partial success. I would say that 10%, 20% patients, they show good response to levodopa for a few years, not for very long, for a few years. So these are the medications for that. And so medications can be beta blocker, primidone for tremor, amantadine, and levodopa for slowness and balance. So that is medication. But we must understand that this is a progressive condition. And apart from medication, what helps is, first of all, being positive, being motivated that I will do something, I will do exercise, I won't be bogged down by disease. And exercise is very important. That regime of exercise, which combines everything, which combines strength training, which combines walking, which combines cycling, because cycling, walking is a cyclical process, and that helps in improving the coordination and walking. So rehab exercise is very important. I have seen very clearly that those patients of SCA12 who do regular exercise, in general, in due course of time, they do better than others who don't do regular exercise. Finally, this is a disease which affects a lot of well-to-do population, and I suggest them to start taking good food right from the beginning, because obesity is a big problem there. In case of obesity, balance already is affected. In case of obesity, balance will be more affected. So good food, exercise, and of course medications with under care of doctor that do help.
What are the implications of late onset and slow progression of SCA12?
In SCA12, it's so slowly progressive and late onset that by the time you have disease, you already have kids, and some of the kids might have the disease. So I would say that yes, this disease is increasing in number because of same issue. Having said that, I don't say that we should not have kid. The reason is that this is a late condition, which is late onset. And any person you see, I have a patient who is a big business person who has created an empire. I won't say the name, I won't say the business also, but he is suffering by SCA12. He's 77 or 75 right now. He's suffering for last 20 years. But you can see that he has created empire. He has given employment to 5,000 people. He has given something to the family. So SCA12 is not bad disease, and it's not that we should be very strict in having childbirth or having further progeny. So at the same time, we explain to them that this is the condition where 50% chance that your child might have. If somebody comes with a father, I would say that a 50% chance you might have. At the same time, don't worry, keep on continuing work. And if they are quite persistent that they want to know about the diagnosis, we can do blood tests in asymptomatic patient, but that's a big problem. When a patient is functioning and they know that I have SCA12, it may affect me after 10, 15 years time. They might lose motivation. So before going for any test in non-symptom patient or asymptomatic patient, we suggest to go for proper counseling, to think multiple times whether they will like to know or not, and only then we go ahead.
What is the significance of the numbering in SCA12?
Yeah, I would say that when we talk about various numbers, they all are separate disease. They all are genetic condition. They're completely different disease. They get the same name because they present similarly. They have ataxia, some have tremor. But because they are different disease, different gene is involved. So the word is spinocerebellar ataxia. That means the cerebellum is involved, degenerating, and the spinal cord is degenerating, right? So that's SCA. And as they kept on finding different genes, they gave different names, SCA1, 2, 3, 4, like that. And right now, there are almost 50 types of disease. So once you have SCA12, right from birth, you have SCA12. You cannot convert from SCA12 to 13 or SCA12 to 14, right? This is a disease which is there since the birth, will remain there. So somebody who has SCA1, right from the beginning, gene is different. They behave differently as compared to SCA2, as compared to SCA12. They have different combination of symptoms. I'll give one example. SCA12, SCA2 has eye movement problem. SCA12 has tremor, which is not seen in SCA2 commonly. So all are different diseases. Depending upon the discovery of gene, they were named. And because they are different diseases, they behave differently. Only SCA12 in Agarwal family, right? In India, overall, SCA2 is more common overall, but SCA12 is only Agarwal family. In India, what SCA is seen generally, SCA1, 2, 3, 6, 12, and then some other 17. So if you ask me that how they present, because every name has cerebellum, balance problem will be common in all the conditions. So balance problem will be common. Apart from that, think of SCA2, I told eye movement problem. SCA3, they have a lot of spasticity. Spasticity means stiffness of the legs. Those conditions, apart from SCA12, whatever we talked about, SCA1, 2, 3, they are young onset. The symptoms start from first, second, third decade. So the young onset, rapidly progressive, less tremor, and they cripple patient little faster. In those cases, when we go for MRI, we see the changes in the brain, that means cerebellum, more dominant. The back of the cerebral back of the brain, it dries up more prominently as compared to SCA12. So what I meant to say that there are various SCAs all over the world. Depending upon the gene discovery, they were given the name. In one region, some SCA are common. In other regions, some SCA are less common. For example, let's think of Portugal. Portugal SCA3 is very common, and SCA12 is not there at all. In India, SCA1, 2, 3, all are seen, but 2 is more common, and SCA12 is also common. So all are different disease. In one line, I would say that as the earlier SCA, what we talked about, SCA1, 2, 3, they're young onset, and SCA12 is later onset. Some SCAs, think of, say, SCA10, almost not seen in India. Maybe 1 or 2 family almost not seen in India. When we do a gene panel in India, it doesn't test for all the SCA because that's useless. It's not found here. Only 6-7 genes are tested, and that includes SCA12.
How should young Agrawal couples approach genetic testing for SCA12?
One good thing about SCA12 is autosomal dominant, right? So, and what we call is penetrance. Once gene is abnormal, almost all the patient will have symptom in some part of life. So if a family comes to me that my father has history, I see the family history of both the families, means the girl and boy. If girls or family also carries such gene, if boys family also carries such gene, then chances more. Of course, both will might have gene. So if they ask that whether we should go for child bearing for child or not, I can tell you that as a doctor, it's very difficult to say yes or no in this condition. In those conditions where uh, death is young, or on those conditions where disability is quite young, it's easy to tell. In this condition where disability is late onset and it's not that disabling, then I give all the fact on the table and then I ask them or help them to decide. First of all, uh, if young family doesn't have symptom, it's possible that both are SCA12 free, because as we know, that's only 50% chance of getting SCA12 from the parents. So who knows that this gentleman or the girl, none has SCA12. So if they are really keen to know that what to do for the childbearing, then I suggest that if you really want to go for that, you can go for a gene test of both of you, so you know what is your status. If after proper counseling they agree to it, if both are negative, that's fine, nothing to be done. If somebody is positive, then you have 50% chance of giving that to the children. Still, that doesn't mean that you should not go for a child, because we keep all the fact that you have gene positive, you might have symptoms in late age of life, your child might have another 50% chance of having symptom. But as this is late onset disease, if you take that risk that okay, if this will happen, still I'll go for the child, they can go. It's not that that is precluded. But my job is just to put the facts that you might have or your child might have 50% chance of having symptoms in due course of time. If you want to go for that, you can go. Now, regarding not having child or aborting the kid, this is beyond. Nothing is clear in India, as we know. So I don't give clear indication that what you do. I keep the things on the table and they decide about this. Yeah, the guideline what I can offer is as per my experience. There's no written guideline per se for such conditions, as you know. So first of all, if the patient comes to me and the patient already has child, say small child, and they have father who has a SA12, I don't I don't encourage testing, because they already have child. So what to be done right now? But if
Yeah.
somebody is planning pregnancy and if somebody really want to know what is my status, then I send the patient to my genetic counselor. I suggest they can go for that after thinking properly. So I would say that yes, they can go for that. But before that, even I counsel them that if it comes negative, you are happy. If it comes positive, don't worry at all. I'm there, and disease will come very late. So still you can live a good life. And once I see that they can accept properly, then we send for the testing.
Are there support groups available for SCA12?
This is such a rare disease that hardly any support group. We have a support group here in Calcutta. We call it SCA12 Consortium, where we uh, have a number of patients, and we had some meetings to start with. I encourage them to meet with each other. So SCA12 support group is very important. It's more important that I would say than any other disease. The reason is that the questions you asked, that how the symptoms are, they can teach each other. They can teach you how they are coping, because they are from same group, they have cultural background is same, and they can understand each other very well. So support group is very important. Support group helps both ways. It helps patients as well as doctors, because what happens that many symptoms, when we start explaining in the OPD, it takes a lot of time to explain how to go forward. But suppose a support group is there, and I send a rehab person or therapist to talk to them. In one go, we have talked to them. Sometimes we do a meeting of a support group, SA12 consortium or support group, where in say half an hour, I give encapsulate all the medications, all the progress, recent progress, and this itself helps me to reduce my time in subsequent OPD. So support group is very important. We have a support group here, but support group in any part of country, I am not aware of that, but time has come to have more and more support groups. I find interesting because the community we are talking about, they are very sort of traditional. As we know, they are traditional, and I could see a lot of taboo regarding that. A lot of if somebody has tumor, they feel that something wrong is there. But when you have support group, they're more aware about the disease, and they know that this is part of life. They have to live with it, and they have to help each other. So support group also helps in reducing the taboo about the disease.
What are the psychological aspects of dealing with an SCA12 diagnosis?
Generally, it affects this population, which is a businessman, very successful businessman, and they see that I was so good at one point in time, and suddenly things are getting downhill because of my mobility, because of my tremor. So they start going to shell, and it's very important to let them know, let them understand that this is not their fault. This has happened, and they have to fight with this. Second thing, I have seen that as a part of psychological aspect, they try to avoid meetings, or they try to avoid normal gatherings like marriage. I keep on saying, and again, support group helps, that tremor is there. There's no need to hide yourself because of this. Go out, face the society, and due course of time, they will understand what it is. Then coming to the disease itself, initially it's a motor condition. Motor means tremor, motor means walking difficulty. But in due course of time, it does affect other part of your brain, and that leads to some psychological issues. One issue is that depression itself can be part of SCA12, not in early case, in advanced case, in later case. After that, dementia, mild memory problem to start with, and later on more memory problem, that can be part of SCA12. Psychosis, that's thinking which is not relevant, or talking which is not relevant, that can be part of SCA12. So these are non-motor aspect. You can say some are psychological. They should be dealt and treated as we deal with any other psychological disease. Suppose somebody, a case of depression comes to me who doesn't have SCA12, we treat them, right? Same with depression can be treated in SCA12. So we must understand that SCA12 can cause psychological issues secondarily because of motor problem, and primarily because it affects some part of brain, which can lead to psychological problem. In both the condition, medication treatments remains the same what we do in other conditions without SCA12. Because I see at least 200 patients with SCA12 in my OPD. I would say that answer is that females somehow they cope better. Multiple things. First of all, they don't have to go out. They don't have to manage business in majority of patients. Third is that somehow I have found that in this population, as they are well-to-do, they start resorting to exercise more, females, as compared to males. They start to having proper diet more because they're at home, they can afford that also. I would say that, yes, females somehow they cope better than males because of multiple reasons. One reason is that males have to go out. Second reason is that males have more psychological trauma, that I was so good and suddenly things are going downhill. They have to interact with more people. So males somehow are difficult.
So,
I agree. And what I have seen in the support group, females are more active. Means
okay.
females, those who are affected or those who are spouse of the patient, they are more active.
Are genetic tests for SCA12 a definitive diagnosis?
Fortunately, test is very simple. As you send for a normal blood test, we just take 2 ml of blood, of maybe 5 ml of blood for the gene test, and in 3 to 4 weeks time you get the answer. So testing is very simple, and there are labs all over the India right now, and if the city doesn't have lab, they have a collection center. So this can be in any small city of India without any problem. It's just a matter of blood test where we write SCA12 gene test and we get the answer. So testing is very simple. Unfortunately, this is monogenetic. This only one gene is involved. So answer is not unclear. It's clear answer, yes or no.
SCA12 is monogenic. What does that mean?
When we call as monogenic, that means only a single gene is involved. So you don't have to test for multiple genes, right? You have to test for single gene. If this is abnormal, that's fine. The test gene means blood test for that particular patient. Now coming to autosomal dominant, that's a different thing I was telling. So when we call as autosomal dominant, means 2 of the gene. I'm talking about SCA12 gene. So think that SCA12 gene is there. 2 of the gene, one is abnormal, right, and one is normal. Because it's dominant, even one abnormal gene will rule that, and the patient will have symptom. So suppose somebody comes with a blood test that their gene, the 2 genes for SCA12, one is abnormal, one is normal, still the patient has symptoms. Okay. Now what happens? So that's autosomal dominant. What happens when you have a child? So out of the 2 genes, one is normal. If you give normal gene to the child and another your wife or who doesn't have SCA12 or even have SCA12 and they give normal gene to the child, so both the genes to the child is normal. That means child won't have and their kids won't have. So when I see autosomal dominant, means out of 2 genes, one has disease, and once the disease has, it will manifest. It will have tremor, it will have walking difficulty. But during childbirth, it is just a matter of dice that if we pass the normal gene, because one gene has to go, one gene will come from male, one from female. We pass the normal gene, that means child won't have. So there's a 50% chance of getting for the child and not 100%.
What are the ways in which SCA12 can be contained?
Another way that to have a prenatal diagnosis, that little crude way, but prenatal diagnosis or testing yourself before even conceiving, and then decide whether we like to go for kids or we like to adopt. But this is very shady area, I can tell you. I can easily tell about Huntington disease. I can easily tell about SCA1, 2, 3 because kid will have young onset problem. But I cannot say easily about SCA12 because in that case also, despite kid having SCA12, they can live a good life. So I tell everything and then family has to decide. But yes, if you ask that, what is the best way to prevent spreading? Marrying in other community, number one. Second, maybe getting the test done before conceiving and then deciding whether we like to go for kid or we'll adopt the kid. And finally, prenatal diagnosis can be done, and through the sampling of chorionic villus, and then you can decide whether like to keep the kid or abort the kid. But in such cases, such a benign condition, this is a little inhuman to think about that.
Are alternative therapies for SCA12 effective?
I get a lot of questions regarding extreme therapies like stem cell therapy, like a condition known as DBS, a therapy known as deep brain stimulation, that's brain pacemaker, and a therapy known as MR guided burning of area, because called as focus ultrasound therapy. So I like to touch upon this, and then we can talk one or two more questions. There are some medicines to improve the symptoms, like tremor can be improved to some extent, slowness can be improved, balance can be improved to some extent. There are physical exercise to help the patient. But patient, they want to get cured, and they ask me about various options like brain surgery, known as brain pacemaker, or deep brain stimulation. They also ask about a new modality where they use MR guided focused ultrasound therapy or burning of the area, known as thalamus, area is thalamus, or stem cell. To answer these questions, I say that stem cell is, I say no, straight no, because stem cell, there is no evidence till date that it helps in such conditions. And the centers which are doing stem cell in India, somehow I feel that they should do a little more scientific work rather than commercial work. Second, I would say that regarding DBS, brain surgery for SCA12 or burning an area for SCA12. So these two modality, they may help in only tremor, and that too only partial. They don't help in balance problem. Till date, the evidence is very small. So if you have really bad tremor that you cannot hold something, then you can think of these two conditions. They are proven in other tremors like essential tremor, Parkinson's tremor, not in SCA12. But as part of therapy, there is no harm in going for that if tremor is really bad. But don't expect that whole disease will improve, right? Because the disease is not only tremor, it's also balance difficulty, speech problem. In fact, in some cases, DBS can worsen the balance. So I suggest about these extreme modality only when the patient has tremor which is troubling them a lot and balance is reasonably good. Only then I suggest, and that too also in small number of cases.
Here we can see increased tremor of hand when patient approaches the target. We can see tremor over right upper limb, predominantly involving proximal part in assuming particular posture. Unable to walk on straight line. Patient often makes mistakes requiring support on tandem gait or walking heel to toe. We can see broad-based gait along with swaying towards both sides. This is cartwheel patients depicting gait ataxia.